Depression, stress, hopelessness, and sadness are all common experiences that can affect people at various points in their lives. These feelings can be difficult to cope with, and they can have a significant impact on a person's mental health and overall well-being. In this article, we will explore these experiences and offer some strategies for coping with them. Depression. Depression is a mood disorder that is characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities that were once enjoyable. It is a common mental health condition that affects millions of people worldwide. Depression can also cause physical symptoms such as fatigue, changes in appetite, and sleep disturbances. There are several different types of depression, including major depressive disorder, persistent depressive disorder, bipolar disorder, and seasonal affective disorder. Major depressive disorder is the most common type of depression and is characterized by a persistent feeling of sadness and a loss of interest in activities that were once enjoyable. Persistent depressive disorder is a milder form of depression that lasts for at least 2 years. Bipolar disorder is characterized by extreme mood swings, including periods of depression and periods of mania. Seasonal affective disorder is a type of depression that occurs during the winter months when there is less sunlight. There are several different factors that can contribute to the development of depression. These factors include genetics, environmental factors, and life events such as trauma or the loss of a loved one. Some medical conditions can also contribute to the development of depression, including thyroid disorders, chronic pain, and chronic illnesses. There are several different treatments available for depression, including therapy, medication, and lifestyle changes. Therapy can be an effective way to treat depression, particularly cognitive behavioral therapy, CBT, which focuses on identifying negative thought patterns and replacing them with more positive, realistic ones. Medications such as antidepressants can also be helpful in treating depression. Lifestyle changes such as exercise and healthy eating can also be helpful in managing depression symptoms. Stress. Stress is a common experience that can affect people in various ways. It is a natural response to challenging or threatening situations and can be beneficial in small doses. However, chronic stress can have a negative impact on a person's mental and physical health. There are several different types of stress, including acute stress, episodic acute stress, and chronic stress. Acute stress is a short-term response to a challenging situation, such as an exam or a job interview. Episodic acute stress is characterized by repeated episodes of acute stress, often due to a person's lifestyle or personality. Chronic stress is a long-term response to ongoing stressors, such as a difficult job or relationship. Stress can have a significant impact on a person's mental health. It can lead to symptoms such as anxiety, depression, and irritability. It can also have physical symptoms, including headaches, muscle tension, and stomach problems. There are several different strategies for coping with stress. These strategies include relaxation techniques such as deep breathing and meditation, exercise, and time management. It is also important to identify the sources of stress and find ways to reduce or eliminate them. Hopelessness. Hopelessness is a feeling of despair or lack of hope for the future. It is a common experience that can be a symptom of depression or other mental health conditions. It can also be a response to difficult life circumstances, such as job loss or a relationship breakup. Hopelessness can have a significant impact on a person's mental health. It can lead to symptoms such as depression, anxiety, and a lack of motivation. It can also lead to suicidal thoughts or behaviors. There are several different strategies for coping with hopelessness. These strategies include seeking professional help, such as therapy or medication. It is also important to engage in self-care practices.
It is important to note that while depression, stress, hopelessness, and sadness can be challenging experiences, they are also treatable. With the right combination of strategies, it is possible to manage these experiences and live a fulfilling life. Depression is a complex condition that requires a multifaceted approach to treatment. While there is no one-size-fits-all cure for depression, There are several effective treatments that can help manage and alleviate symptoms. Therapy. Therapy is a common and effective treatment for depression. Cognitive behavioral therapy (CBT) is one of the most common forms of therapy used to treat depression. CBT focuses on identifying negative thought patterns and replacing them with more positive, realistic ones. Other forms of therapy, such as psychodynamic therapy and interpersonal therapy, can also be effective in treating depression. Medication. Antidepressant medication can also be effective in treating depression. Selective serotonin reuptake inhibitors (SRIs) are the most commonly prescribed antidepressants. SRIs work by increasing the levels of serotonin in the brain, which can help alleviate depression symptoms. Other types of antidepressants, such as tricyclic antidepressants and monoamine oxidase inhibitors (MAOIs), may also be used. Lifestyle changes. Making lifestyle changes can also help manage depression symptoms. Regular exercise, healthy eating, and getting enough sleep can all help alleviate depression symptoms. In addition, reducing or eliminating alcohol and drug use can also be helpful. Stress is a natural response to challenging or threatening situations. While it is impossible to completely eliminate stress from our lives, there are several strategies that can help manage stress and prevent it from becoming chronic. Relaxation techniques. Relaxation techniques such as deep breathing, meditation, and yoga can be effective in managing stress. These techniques help to calm the mind and reduce feelings of anxiety and tension. Exercise. Exercise is a great way to manage stress. Regular exercise can help reduce the symptoms of stress and improve overall mood. Exercise also releases endorphins, which are natural chemicals in the body that help to reduce stress and improve mood. Time management. Poor time management can contribute to feelings of stress. Learning to manage time effectively can help reduce stress and increase productivity. This can include prioritizing tasks, setting achievable goals, and learning to say no to unnecessary commitments. Social support. Having a strong social support network can also be helpful in managing stress. Spending time with friends and loved ones can provide a sense of comfort and help to reduce feelings of stress.